Hello, and welcome to the training Introduction to Civilian and Military Coordinated Community Response. How to establish and sustain a CCR and useful tools in moving forward. This training is a part of the Advocating for Military Connected Survivors project. Our mission in this project is to provide trauma-informed and survivor-centered training and technical assistance, or TTA, that empowers legal personnel, victim advocates, and allied professionals to support military-connected survivors of domestic violence, dating violence, sexual assault, and stalking, or DVSAS. This project is awarded by the Office on Violence Against Women through the Department of Justice. We're very grateful for that award and excited to share this information with you. Thank you for watching this presentation, and it's very important to my colleague, Dr. Ava Ramirez-Inne, and I, that we introduce ourselves as this team of the Advocating for Military Connected Survivors project. I will be presenting the entire presentation today, but Dr. Ava Ramirez-Inne is the Military Coordinated Community Response Senior Program Manager. She is also a retired U.S. Marine Corps veteran and a prior uniform victim advocate. That is a picture of her on the right-hand side. And again, I am Kim, and I am a licensed master social worker. And at NOVA, I'm the Military Coordinated Community Response Program Manager. I served 10 years in the Navy, and like Ava, I was a sexual assault victim advocate during my time in service while serving in the Navy. The objectives of this training are to explore a collective approach to addressing DVSAS, to define a coordinated community response for military and civilian partnerships, and to provide foundational knowledge to build your civilian and military CCR team. Before we jump into what is a CCR team and what does that military and civilian partnership look like, we want to talk about collective impact. One of the foundational approaches that we really encourage organizations, both military and civilian organizations, to use in their CCR teams is collective impact, which basically means that this is an all-team effort. This approach is used because we believe that the whole community needs to be involved in addressing domestic violence, dating violence, sexual assault, and stalking, or again, DVSAS. We cannot do this work alone. And so the collective approach really helps us address these issues together. The Coordinated Community Response Team, or CCR team, is a group that is diverse, it's multidisciplinary, and it commits to a common agenda. And we'll talk more specifically about what makes up a CCR team and what those goals are and how to go through the CCR process. But what we really want to take away from this is that the purpose of a collective impact approach is not only to bring multiple folks to the table, but also to achieve alignment. For example, many different organizations and agencies are addressing issues from their own perspective or from their own experiences or disciplines. And often the programs that they develop can actually compete with one another or maybe even contradict one another in their messaging. So what's important is that they align in what they're trying to do and accomplishing really shared goals and missions, but doing so in a way that has a shared message with a collective approach. So one of the things that a collective approach does is it makes sure that the programs are consistent and reinforcing, which ultimately that creates less work for the overstressed systems and staff members that we know are in this line of work. Many of us know that one of the challenges to group work is that when you're working with different organizations and different agencies with different experiences and capacities, we all bring in different values and experiences, but we're not all starting from the same place. So we need to acknowledge and make adjustments when there's imbalances that might occur or that might exist. This means that the team will have to identify and overcome any intentional or unintentional barriers that can arise from these systems. And so it's intended, this is intended to be a space to really encourage strategic learning and to build not just the individual teams and organizations' capacity, but also the entire team, as in the CCR team's capacity, to understand the complexities of supporting military-connected survivors of DVSAS and the services and programs that they need to best support them in their journey. We also want to improve the policies and the procedures and the processes that they may need in the different environments throughout the different areas, both geographically and that military connected survivors may be located, as well as the different stages and different areas of DVSAS that they may encounter. So again, in order to do this kind of work, we have to have a collective impact. As you see on the screen, the definition of collective impact is a network, community members, organizations, and institutions that advance equity by learning together, aligning, and integrating their actions to achieve population and systems level change. So where do we start? How do we bring a team together? How do we make a plan? How do we even know who to talk to build this team? And what do we do once we have the people sitting at the table? Well, this is what we've developed this toolkit for. This is our military civilian CCR team development toolkit. You can scan this QR code or use this link that you see on the screen. This checklist provides new and existing CCR teams with a step-by-step guide for assessing, engaging, and evaluating the unique needs of military-connected survivors within a community CCR approach. This toolkit is set up again in a format of a checklist that is also fillable for you and your team, or maybe your internal organization, to go through and identify what you need to do to start or build or strengthen your current, possibly CCR team. And we're going to work through this as the presentation continues. So what is a CCR team and what are the goals? A CCR team, or Coordinated Community Response Team, is a multidisciplinary team of military, civilian, and community partners that meet regularly to assess, plan, monitor, and evaluate their prevention and response efforts focused on, again, DVSAS, domestic violence, dating violence, sexual assault, and stalking. So I understand that each CCR team, depending on their purpose, may have a unique mission and goals. However, for the purpose of preventing and responding to military-connected survivors of DVSAS, we have established these 4 goals that you see on the right side of your screen. It's very important to consider these 4 goals, but also keep in mind there may be adaptations as I work through these 4 goals on the screen because of your geographical area, because of the number of military connected individuals in your area. Maybe you do not have a base or an installation in your area, but you have a lot of veterans. Or maybe you don't have a lot of veterans, but you have a lot of trainees or a training command in your area. So it's very important to consider these goals, but also allow for the adaptability of these goals to ensure that you're still succeeding and addressing the DVSAS in your area, as well as on a larger scale. So first is prevention and response. And that means not only standing up a team for after an incident review and decisions and accountability, but also prevention efforts, coming together to look at the environment and also the choices that need to be taken to prevent instances and the prevalence of DVSAS. This can include subcommittees, fatality review teams, intervention programs, and things that can be a more specialized approach. There can also be subcommittees that have the same key players from the CCR, but again, may be different in their purpose and their primary goals. You also want to have a CCR team to build the capacity. Building capacity of a CCR team is crucial. We do not want to add meaningless meetings to our already packed schedules, but we really need to be designed to allow the key players to make good decisions on behalf of survivors and the community, whether that it's civilian or the military, to transform the environment to meet the big picture of the prevention and the response goals. Next is community engagement. We want to promote a collective position that DVSA crimes are community issues and that it takes an entire community to create an atmosphere where these crimes are not tolerated and community safety is increased. Community engagement also means that ensuring different Groups of people and populations do have a voice and they have access to different services, which means that you may need to take time to understand the unique needs of these different populations in your community and that you are actively and strategically working to provide those services. Traditionally, prevention and response work has been done really by a small group of people and has only served maybe not that many people. But we're looking to invite those who have not traditionally been invited to the table. And that's where a CCR team can really build in the capacity as well, is start thinking outside the box, especially in the military and civilian environments. In the military environment, you have on-base law enforcement. Well, you may also want to consider civilian law enforcement for things like military protective orders and civilian protective orders and how they operate differently. You may want to think about housing programs because there are differences and rules and policies when it comes to on-base housing, who has access to on-base housing, who has access to the housing allowance that is associated with on-base housing, and COLA, the cost of living allowance. And so it could be helpful to engage with the community and have someone who is very well versed in housing services and housing programs out in the community. So again, community engagement is extremely important to your CCR team to be really comprehensive in the prevention and response to DVSAS. And last but not least is the initiatives and policies, which refers to the programs that you are going to develop or enhance as a CCR team. For example, rather than focusing on a one-time awareness event, think about the meaningful and systemic initiatives, such as comprehensive prevention plans and revising protocols so that no matter where a survivor reports, military or community, reports their experience or instance of DVSAS, there's going to be a consistent response and a referral system. So that survivor can go wherever they feel most comfortable. And we know that they're getting the help. Survivors will feel that when they are more comfortable going in the community for support, they recognize that there's a partnership with the military and the community, but that their rights and that their privacy and confidentiality will still be respected, but that they're going to have access to all services and programs, but also have the control to decide what access and services and programs they want to utilize. Here's some things to keep in mind, though. The CCR team is a working group. It is not an advisory council. The CCR team does not discuss individual cases. There are other multidisciplinary teams that are involved in working in the DVSAS type of field that do discuss individual cases. However, the CCR team is not that. They focus on building coordinated, collaborative, and systemic military and civilian response and prevention efforts as well. Now, it's possible that as a CCR team, you may discuss possibly a fatality review or a case review on a broader lens and looking at how can we prevent this kind of environment? How can we prevent the factors that led up to this? How can we decrease these types of risk factors? But you're not necessarily discussing anything private or confidential or anything that could identify the individuals involved. It's more of, again, looking at the coordinated collaborative efforts to improve and enhance the programs and services. So CCR development. Again, we shared with you our guide on our toolkit on how to be able to develop a CCR team or to be able to enhance the one that you currently have. And there are truly, really three phases to this. One is the planning, assessment, and engagement. 2 is to build a team. And then 3 is to sustain and evaluate. So we're going to work through all of these. The first one, when you're planning, assessing, and engaging, you have to know who you're doing that with. And let's talk about the different agencies. Here on your screen are some military agencies. There are both active duty and veteran organizations. A lot of times what we see, especially when it comes to speaking of DVSAS programs and services, we'll see active duty programs and veteran programs operating in silos. So there may be a mental health or domestic violence or sexual assault prevention and response programs, but they're focused primarily or only on veterans or only on active duty service members and maybe their spouses. It's important to consider when you have a CCR team and you're looking at a collective impact and a collaborative approach that you're really thinking about all different forms of military connected individuals. And you're looking at all of these different offices or agencies that could be involved in your CCR team. Then here we also have community agencies. Again, I've already mentioned a few of them, maybe someone who is well-versed in the housing, maybe also civilian law enforcement, but here are some others that are listed out as well. Community advocates. This could be community victim advocates. It could be advocates who are maybe involved in government advocacy or policy advocacy. There's system-based advocates as well. Advocates or individuals or maybe even nonprofit leaders who are involved in emergency housing. There's law enforcement and criminal justice personnel, for example, veteran treatment court or other court personnel who are not necessarily involved in veteran treatment courts, but the civilian court. And this could include lawyers as well, as it says here on the last bullet point. And then anyone who provides medical care and mental health care. This can include the local sexual assault forensics examiners. They may be the only ones who provide the sexual assault forensic exam to the military connected survivors because maybe the base or the installation in your area does not provide that service. So having them on your CCR team is going to be critical to ensure, again, that you are having a collaborative effort and that the services and programs that you're providing are very fluid and collaborative in their ability to work together and that the services and programs are consistent. So let's talk about phase one. Phase one is the planning, assessment, and engagement. After you've considered what different agencies, both military and civilian, that you can include and invite to be a part of your CCR team, you would want to think about who are the military populations in your community. Again, do you have a lot of veterans or do you have a lot of active duty service members? Do you have a lot of families who are maybe families of active duty service members, but you're in an area where a lot of the active duty service members are deployed? So you really just have a lot of families in the area. Is it possible that you don't have a military installation at all? Maybe you're in a very rural area and you may think, well, we don't really have military in our area. I promise you, you probably do. You just don't know about it. You're not asking the right questions. So it's really important to be able to identify these military populations in your community. And you want to connect and meet with them, both the military and the civilian stakeholders. So these are those key leaders and those key individuals who are either the leaders or organizers or advocates of these agencies and systems that I mentioned on the last two slides. Collaborate with both civilian and military first responders to be able to develop a plan to assess the needs of military connected survivors in your community. For example, going back to the sexual assault forensics examiners and the nurses, if you're in an area where there is a military base or installation, but they do not provide that service and the military connected survivor would need to receive that service at an off-base civilian hospital, it's really important to bring in military law enforcement and other first responders, maybe like the EMTs. Maybe you do have EMTs and fire department and law enforcement on your base. You just don't have the medical services to provide the safe exam. So what you would do is assess what would a military connected survivor need of maybe sexual assault or domestic violence in the instance the situation happened on base. What if it happened off base? Who would transport? Who would have to be notified? What if law enforcement responded first? How do we ensure that victim has the ability to maintain privacy and confidentiality and their reporting options? Because in the military, there are two different reporting options. And how do we ensure that they're allowed to keep those reporting options while still getting them health care, especially if it's emergency care, if law enforcement has already been notified? And is that even possible? And then you can also have the opportunity for cross training. And so it's very important to develop, again, that plan for what is going to happen in this scenario. Of course, you're not going to be able to cover every scenario, but by planning, assessing, and engaging, you're able to identify who you're going to call if this happens, or who you should call to possibly get this kind of answer that you may be trying to look for, or that you may not have fully awareness or understanding of. Another example is on-base housing. If you're a civilian advocate and you need to get on base, or you have someone who has come to you asking for help and they live on base and they are trying to leave their alleged abuser who is living on base with them, but they want you to go on base with them to get their stuff from their on-base housing. You don't have access to that base. So what do? Who do you call? Do you call the base law enforcement? Is there a victim advocate on base that you call? What do you do if that victim does not want you to contact anyone from the base? Can you get a pass? Is that the right thing to do? Is that safe? Right? All of these questions that may come up, you want to be able to support that person in getting some of their items and belongings. And what if it's a pet? Right? All of these things start to come to mind of what do we do in this situation if you're a victim advocate in the community without base access, but your victim lives on base and needs to get back on base, but you don't want to send them back by themselves. What does that look like? So doing the planning, assessing, and engaging can help create a plan before the situation or incident even happens. So what are some challenges that are experienced in this phase one, and what are some strategies to overcome those challenges? One is relationship building. It can be difficult to build relationships because maybe you just don't even know who to talk to. That can be really hard on the military side because maybe they've never worked with anyone in the community, or maybe there has not been a strong organization or agency in the community that is addressing forms of DVSAS. On the community side, it can be difficult to build a relationship with the military. Maybe there's fear. The military can sometimes be very intimidating. Maybe there's some frustration with things that have been shared in the media or things that have been reported about the military. And there could be hesitation on the community members' part to want to engage with the military. And that goes to the next line of stereotypes and misconceptions. And those can really hinder or even create hesitation in individuals and organizations starting to build relationships. Language and jargon. There are many different acronyms in the military, and that can make it very difficult to communicate for community advocates, but also for the military advocates as well, because we can be so accustomed and comfortable in the way that we communicate, the acronyms that we use, the way that our style is, how fast we communicate, our approach to communicating, and that language, that jargon, that approach can create some barriers and challenges. And last is historical context. By historical context, you have to look at the geographical area that you're in. You have to consider the different forms of relationships that have been built in the past and what happened with those relationships, the strength of those relationships. You have to look at what has happened in the past, maybe politically, possibly, but other just historical events that could impact or create challenges for military and civilian partnerships. And take that into account and consideration. Be sure to acknowledge and validate those situations so that you can overcome these challenges. And so what are some strategies to be able to overcome these challenges? One can definitely be cross-training. That can help develop relationships. It can help decrease the stereotypes and misconceptions. You can share some tips, create a tip sheet on some language and jargon. We have some here at NOVA as well. And it can help share some of that historical context and just open up some perspectives and as well. And so having cross-training, having military agencies train some of your civilian or community partners locally and vice versa can really help in building those partnerships building those relationships, and setting the stage for phase 2 and 3. So phase 2 is building that team. So now that you have started to plan, you've started to engage, you've started to assess different situations or scenarios or the need for creating a CCR team, you can start to recruit specific team members and identify a leadership structure. Now, it's really important as community advocates to recognize that the military is used to a very hierarchical form of structure, and also recognize that doesn't necessarily mean community advocates are, and vice versa. But it's also important maybe to remind each other of that. When you're working with military partners and military partners working with community advocates, just recognizing that you do operate differently. And it doesn't necessarily mean that you have to do it one way or the other to be successful. You are working collaboratively towards your shared goals, towards the shared goals of your CCR team. And that's why you develop a mission statement and your shared values for your team. And you establish regular meetings, defining your roles and even defining bylaws. This can help you identify and prioritize areas for action. This is important because it gives ownership and responsibility. So if you were to say simple things as we need a logo, or we need some marketing materials, or we need some informational sheets, or we'd like to have an open meeting for our public, and we would like to have an open meeting for local advocates. We need someone to plan that. We need someone to do the marketing. We need someone to be the secretary. Make sure you're prioritizing different areas, not just for coordinating the CCR team, but also for being able to develop the deliverables, the programs, the services, and the actions that you are trying to do to have an impact on preventing and responding to DVSAS. Then this is also where you can facilitate the cross-training that I just explained. You can develop and implement a strategic plan, both with short and long-term goals. This will really help with turnover, which I'll talk about in a moment as well. And then you can create memorandums of understanding or memorandums of agreements and confidentiality statements. This can definitely help with organizations understanding their roles and responsibilities. We have a template for this that is accessible to you. And a good example of this is for military and protective orders. If, for example, if a civilian law enforcement agency encounters someone who does have a military protective order, what is going to be the process and what does that look like? What can that local law enforcement agency do? Who do they contact? Does everyone on the civilian law enforcement agency know who to contact? How are they going to be updated on if that contact changes? Because military people transfer all the time. And so having that MOU can really define that process. So when people do transfer, when there is that turnover, the continued services and programs do not see that gap and do not start to fail or fall through the cracks. So what are some of those challenges that you see when you're trying to build that team in phase 2? Is priority alignment and conflicting values. This is important to really sit down and recognize that, again, each of you may be coming to the table with your different missions from your organizations or from your experiences or your knowledge or your expertise. But what is your shared values? What is your priorities as a team? And how can you align those? At the end of the day, you are working to support military connected survivors of DVSAS. You are working as a team to prevent and respond to instances of military connected DVSAS. So you want to have shared contributions and accountability. And I'm sure many of you watching this have either been on a team or heard about the team or have seen a team where one or two people were managing everything and nobody else was really doing much. Maybe that's been you on either side. And that's important to recognize because you want to make sure there are shared contributions. You want to make sure there is shared accountability and that everyone has a piece of the puzzle that they are contributing to, and that they are being held accountable for that as well. Then there's information dissemination. How are we going to share information Some organizations are much more comfortable sharing certain information about the CCR team and what they're doing, and really just about the rates and prevalence of military DVSAS, military connected DVSAS, not just on the installation, but in their community. Whereas other organizations are not very comfortable sharing it. And so information dissemination can even be a challenge. And then policy differences. There are different policies within the DoD, among different service branches. Now you have to consider the community policies. States, counties, local townships, cities, communities, they have different definitions, policies, criterias, legal terms when it comes to DVSAS. So the policies can be different, the procedures can be different, the criteria can be different. And so this can be a challenge when you're trying to build a team. These are things that you can work through using our checklist to ensure that, again, at the end of the day, you're working to support military connected survivors of DVSAS, both in prevention and response. So the last phase is to sustain and evaluate. I have seen organizations come together, both military and civilian, and create really awesome CCR teams and really awesome multidisciplinary teams and really start to have an incredible impact. And then they forget the sustain and evaluate piece. This is where you really have to identify opportunities for leadership and changes and role changes, because there is turnover, not just in the military, but also in the civilian sector as well. I mean, you have got to ensure that you are being sustainable. This is where program evaluation comes in, to be able to say, you know what, this is working, but this isn't working. You know what, this is what we intended to happen, but this is not happening. Hey, we said these are our goals. We're not really reaching those goals. What do we need to change? That program evaluation is important to ensure that you are sustainable and that you, again, are working towards your shared goals and mission along with your aligned values. And then succession planning as well. I always recommend that at least one person, of course, from each agency, but really, ideally, 2 people from each agency or organization be present during these meetings and activities. So that if one person is not able to attend, then there's already another person. So now the full agency is not missing out on an activity or a meeting. So what are some of the challenges there? Some of the challenges is just personnel rotations. People change and they don't always have the most notice. It can be a very quick turnaround in them leaving, and there's not a lot of turnover. There can also be limited resources that are available, both to the military side and the community side. Also, again, think about the geographical area. If you're in a rural area covering large square miles, a large amount of square miles, that can be difficult in being able to develop a CCR team that is effective. And then there could be policy changes. You can develop a great approach, great response approach, some ideas, some collaborations, some MOUs that clearly define what's going to happen if A, B, C, and D happens. But then a policy changes. That can be a huge challenge. Schedules and meetings can be really hard to get on the same page. And that's where it really takes commitment from the organizations that you're working with. And again, another reason why I stated that you should probably have 2 people from each organization present. Next is the mutually reinforcing activities. So ensuring that the activities that you're doing are reinforcing your CCR team and the CCR team goals. Really consider when you're thinking about, hey, let's do this booth, or let's pass out these lanyards, or let's go do this car show, right? Like some of these activities that have been done, are they really aligned with and helping you as a team reach your goals of your CCR? Are they helping you prevent and respond to effectively military-connected instances of DVSAS? And then another challenge is continuous communication. Find a way, whether it's a shared drive or Google Drive, SharePoint, some sort of shared communication system that everyone has access to, that they're able to use And they're able to reference. If someone misses a meeting, they can go in and look at the meeting minutes without having to email you. Why is that helpful? It's helpful because they can do it on their own time without emailing you. They don't have to wait on your response. And they may be able to do it right then and there instead of waiting for you to respond 2 days later. And now they don't have time and they probably won't look at it until the next meeting. And so, think about how can you make continuous communication possible and easier. So what does your first CCR team meeting look like? Your meeting should really model the CCR team that you want to create. What do you want your meetings? What do you want your team to embody? What do you want your goals? What do you want your actions? What does it look like for you when you say this has been successful? You want to consider when you're walking into a meeting, what do we have accomplished by the end of this meeting? What are we going to have accomplished before the next meeting? And what are we going to accomplish by the end of that next meeting? You want to get to know your CCR team members. There's definitely nothing wrong with doing an icebreaker activity or get to know you activity before every meeting, because you may not really be familiar or maybe have never met some of these individuals that are now on your team. You want to ensure in that first meeting that you identify the purpose and the role of the CCR team. Again, this may adapt a little bit as you work through the evaluation, as you work through aligning your values, but it really wouldn't change much. You really want to be able to clearly identify the purpose and the role, especially as you're starting to build your team. And then align the CCR goals and determine your core team members. I mentioned earlier that we have an MOU template, a memorandum of understanding, or some call it a memorandum of agreement template. This is very important when it comes to CCR teams because it can help clearly, it does help identify clearly the roles, the responsibilities, what process works when and how, what policies to use or what policies to reference when conducting certain activities in relation to military connected DVSAS. As it says here, it can identify the roles and responsibilities. It can work out any jurisdictional issues. It can help with communication expectations between different agencies. So it can state, please don't call the hotline number. This is who you would contact. You wouldn't necessarily call the entire hospital. You could call this program or this department. It also can help with the safety planning process. Going back to the example of going on base with a victim who lives on base, but the advocate is a community advocate. What would that safety planning look like if that person is now trying to move off base? And how does that victim get back on base to get some other items if that's a reasonable expectation or idea, and do so in a safe manner? It also helps with reporting and data sharing, of course, maintaining confidentiality and privacy. And then it just enhances the options for victim services because it lets the military connected community know, and the civilian community know as well, that we support each other. We recognize people are going to most likely go where they are comfortable in receiving support. And we want to ensure that we all have the capacity, the skills, and the knowledge to be able to provide that support. So again, these are your 3 different phases of CCR development: planning, assessment, and engagement. Building a team, sustaining and evaluating. And through these 3 different phases, each of them have their steps. These steps, again, can be found in that toolkit that I shared at the beginning of the presentation. So what are your next steps? So the next steps can feel a little overwhelming. You do not need to run out into your community, call all the military agencies that you know in the area, start Googling and figuring out who and what base is near you. First, you need to take a deep breath and really just review and reflect. What in your community in relation to being to military connected DVSAS and military connected survivors of DVSAS, what in your community needs to be addressed first? What are some of the challenges or gaps that you have been seeing from your perspective in your work, in your area of working in this field? And then consider what is a strategy or tool that we've shared with you today that you can possibly implement internally in your agency. And then I want you to think about reaching out to at least one new potential partner. Who can you communicate with and say, hey, you know what? We've never shared a lot about each other's services, or maybe we have, that was a long time ago. Have there been any updates? How about we do a cross training? What if we co-collaborate on a training and co-facilitate an event where we both share trainings, or we have the half-day symposium where we bring the organizations together and maybe kind of do a kickoff? But really just think about, you don't necessarily need to jump into starting a CCR right away, but you do need to start taking the steps to working into implementing a CCR team in your community, or again, enhancing the one that you have, ensuring that there is consideration for military connected survivors on that team. And remember that we are always here to help. We are here to help you through training and technical assistance. We're here to help you with different tools and guides, and as well as a communities of practice. So you can always reach out to us and our team and ask either specific questions or general knowledge, or if we do have a tool for a certain specific question that you have, or a common gap or challenge that you're seeing. And if not, we will most likely create it for you. This is our contact information, and I look forward to learning more about the CCR teams that you're building and you're enhancing in your area. Thank you.